come in, please come in, sit down. Are we live? Okay, right, good evening everyone. Sorry, we're, excuse me just for a moment, we're just going live on Periscope because we're broadcasting this Sentinel event globally and to Potter's Bar. So if you're joining us on Periscope, good evening and welcome. Thank you very much for joining us. I hope Terry hasn't cut the top of my head off. Actually, I hope she has, because I don't want people to know I'm going bald. Anyway.
Yeah, do you want to turn around, Roy?
Yes. Okay. Do you want to see?
Yeah, got it in nicely.
Thank you very much. It's actually I thought I should have gelled up, shouldn't I? This evening I got the wrong haircut tonight, and it's very nice to see you. Can we give a round of applause for two very brave ladies? They're whistleblowers, and they did a great job when they blew the whistle. So it's very nice, and it's very nice to see you all. It would be right for me to say thank you, of course, to Interserve, who are our sponsors for this this session. Well, it's nearly running out.
2015. Yeah.
Yes, it's for 2015. They've been our partners, and that's now running out, and we may not be able to do these anymore. And we don't know what's going to happen next. We really don't. And I don't know if Interserve are going to help us anymore. But it would be nice if Interserve did help us. Because Interserve are a very nice company. Hey, is that enough? More Interserve, Patrick. Is that enough Interserving? Yes. When you're running out of sponsors, you can never have enough Interserving. No, that's right. It's very good. Sorry. And also, it would be right, of course, to thank Salix, who've been our front of house partners since we first started, and we're really grateful to them. And they're carrying on with us. There's no question of them leaving us in the lurch without a partner, Patrick. But anyway. Whatever. And Phil's in the audience, of course. I'll be advertising Phil's book next week. It's time to give it its annual plug. Can Men Cook? That's Phil Hawson's book. Great book. And we try and sell a few copies of his book every year so he could buy his children's shoes. Because he's not sponsored by Interserve. Right, so who's been to one of these events before? Put your hand up. Your right hand is the one with the thumb on the left. That's good, fine. Oh, that's okay. And for those of you who haven't, you're really welcome. What we try and do with this series is to try and sort of demystify some of the things that are going on in the health service and introduce you to the big names doing the big jobs so you can ask questions and just see who it is that's really doing these fantastic jobs and bringing about change in the NHS. That's what we try and do. Unfortunately, we can't always get guests that are that good, you know, but we try and... is that... No, sorry. There's nothing like a good guest, and tonight we've got nothing like a good guest. We've got someone who has absolutely shot to the top of the ranks in the NHS. She has a really interesting background and does, I think, probably one of the most interesting jobs in the health service. So it's my pleasure to welcome, and can we have a real warm health chat welcome to Sam Jones. Okay, do you want a drink of your wine before you start, or have you had enough?
I'm all right.
Okay. Fine, so tell us about the time that your children were nearly taken into care.
I'm so regretting that moment of saying yes. So
hang on, have you turned yourself on?
No, strangely, I haven't.
Ready? Because at my age, you have to do it yourself, right?
I'm on mute.
That's
better?
it. That's fine.
Can you hear me okay?
Can everybody hear Sam okay?
Yes. It's never normally a problem.
Okay, then, no, that's fine.
Sure?
Yeah, I don't think the mic's on though.
No, I don't think the mic's on.
Give it a little tap. I don't want to start. If you're watching on Periscope,
You must be very proud.
come here. If that, let me just have a
Oh,
look.
I'm not getting involved now.
Actually, you've got to turn. That's it. Okay, fine. If you are watching on Periscope, you haven't got the wrong channel.
It's all safe. We're in control.
Give it a little tap.
No?
No, are you on mute now? Can I have another rummage?
You need to...
Can you hear me okay?
That's it.
Yes. Hooray!
Tell you what,
Huge.
Phil, go and get one of my tablets. Right, so, yes, tell us about the time your children were taken into care, Sam.
So I made the mistake. Hello, my name is Sam Jones. I have the pleasure of leading the care model programme. I made the mistake of once telling Roy a moment of weakness as a paediatric nurse and a chief executive by background, where my son, we've now got 6-year-old twins, and my son was on the kitchen side on a bouncy seat. Yeah. And he was bouncing.
They tied him in this high chair while they were in the car.
My husband and I, the two chief executives, were in the kitchen. We turned round and my son skydived off the kitchen side. I can laugh about it now, I clearly couldn't at the time. Face first onto the concrete floor. He's fine.
No damage to the floor.
He's fine. He is absolutely fine. His face wasn't, the bones weren't formed. How am I doing? They rightly made a referral.
We've never had such a good start to one of these, have we? So, yeah,
The whole NHS is safe.
so
We're
they
right.
referred you because they thought this child needed safeguarding.
We
How
won't
little
get
did they know. Anyway, well, anyway, I just thought that was quite fun. So, but you were. Do you see your children often now? So tell me, you're a nurse, weren't you? How did all that? Do you come from a medical, clinical background?
No, nothing whatsoever. My parents did market research.
Yeah.
Market
research.
Yeah.
Much of a job, isn't it?
Well, I remember at 17, with apologies to my father if he's watching.
He's in South Africa, is he?
He is, yes,
Hi,
in South
Dad.
Africa.
Be proud.
I remember at 17.
For a little while.
I'm still talking. Going to spend some time with a very well-known company and looking at the size and shape and colour of bran flakes. I remember driving home with work experience with my dad in the car going, I cannot, seriously, bran flakes, seriously, what's that about? And I worked out pretty early on that that kind of thing wasn't good for me. So I left school. I left school and I went to Israel. I joined the army for a bit, volunteers for Israel, and joined the army. And the deal with my parents was you have to have something to come back to. So I was like, oh, how about nursing? So I fell into.
Did you shoot anybody while you were there?
No. I did all this. It was volunteers. We did all the stuff the soldiers didn't have time to do. So we went to Israel to.
Because we had the SAS last week, didn't we?
Yeah. No. The proper story behind it was that we went to. My brother at the time wanted to be a doctor, and he wanted to get some work experience. So we went to Tel Aviv to do some stuff in a hospital. We got to the airport and they said, you have a choice, would you like to go to the army or a hospital? And I was a 17-year-old girl. Obviously, we ended up in the army. And my brother was like, I've got to go, my mum will kill me if I don't go. He's now a barrister. So it worked out very well. So on a more serious...
This abuse of children seems to run through them.
on a more serious note, so the deal was to have something to come back to, and I was very, very lucky. I started my career as a paediatric and a general nurse. I did my training at Great Ormond Street.
Did you? Because that was different in those days, wasn't it?
I did the old-fashioned integrated training.
Really?
Yes, I did. I did.
Yeah.
And I was very, very lucky. By pure coincidence, I found something that I absolutely was in the right place.
Yeah.
It spoke to me.
Yeah. And I mean, getting in wasn't that easy, was it? I mean, it was quite a difficult place to go. Plenty of hospitals to train, but that was like one of the peachy places to train, wasn't it?
So I'll just let you into a little secret. Okay, so whenever you have a conversation with Roy, it will come back 10 years later. So I arrived at Great Ormond Street. I'd applied for Jimmy's. I didn't get into Jimmy's, and
Gasp from the audience.
I love that, by the way. That was great. And I applied, and I hadn't quite realised that I was doing paediatric nursing. So for those people,
you hadn't realised.
The people that know me well.
They're small people.
People that know me well know that level of detail sometimes escapes me. But anyway, so and it was fantastic, absolutely fantastic. Everything about it.
You enjoyed it. what always interests me is clinicians who go into management. Because I think, who's a clinician here? Put your hand up. Who we've got? Well, we've got about a third, less than that perhaps. And then who's in management here? I mean, it's majority management. and it's the. I mean, I'm always in awe of all clinicians. I think it's a manager's job to create the time and space for good people to do great things.
I agree.
And that's just what we're here for. And, you know, I can't imagine why a clinician would want to be a clinician. I've never understood. You know, how did that happen? I mean, was it kind of a migration, or did you just feel there was more to do? How did that happen?
So I loved and still love, and I'm not registered anymore, I loved everything about being a nurse and being a hands-on nurse, and the care and the attention and everything about that interaction with people and the families, both adults and children. What I really, really didn't like was having to stand by my bed when the consultants did his ward round and not being allowed to speak until I was spoken to. And that kind of didn't feel
like
right. And I remember thinking, not through any kind of that's what I want to be, I remember thinking, I can do better than some of the people that are doing it. And
managing?
It didn't even have a concept of management in my head. So I went to see the director of nursing at Great Ormond Street a few months into my training, and said I want to be a manager, but I don't actually know what it is because I want to wear a suit. And she was fantastic, Sally Nethercott. She gave me, she sat me down, this kind of stroppy student nurse, and said, come back and see me, finish your training, and come back and see me. And that's kind of started people giving me space and time. And then I did the management training scheme. Well, I didn't get in first time. That's a whole separate story, which I'm sure we're going to come back to.
Why didn't you get in the management training?
I've got such good comms training. Because I didn't have any management experience.
Well, that's the whole idea.
Everything about that wasn't.
That's the whole idea, isn't it? The management training scheme.
Well, it was 1994, 1993. I can't remember when it was. I applied and I needed to get some management experience.
I think I was teaching on it.
Yeah, quite. So I went off and I got a job as a business manager in the Outpost. Do you remember the Management Executive Outposts?
Yes.
Which were supporting hospitals to become trusts. Those were the days. And I went from being a staff nurse on the ward to being responsible for supporting trusts to become providers. I had the honour of turning down Malcolm Stant's business plan. Had I known what a business plan is, that would have been okay. I remember phoning my mum from a stationery cupboard and asking her how to send a fax, because when I did my training, this kind of stuff you didn't learn. And the reason I make the point is that when we were doing some stuff about electronic patient records, I think at Barnet and Chase Farm, later on in my career, I remember thinking, it's not about the strategy, it's about the little things that get in the way of the stuff being delivered. And I couldn't send a fax, and I couldn't use Excel. I still can't do that kind of stuff very well. And it's about making sure people understand how to do it, so that's what I did.
In the meantime, there were people like me who ran hospitals before Excel. You can do it. You get a big piece of graph paper, a rubber and a pencil. You can do it. So you were in the Outpost.
I was.
Destroying managers' lives by not letting them become trusts.
I did once apologise to Malcolm. Yeah.
Right. And then what?
And then I applied for the training scheme because I'd done a year, and I didn't get on. I was a bit outraged by that. Devastated, actually, and went to see the chap who was leading the scheme, because I'm like, hold on a minute, I want to understand why not. It was a helpful conversation, but I didn't do the training scheme, so I did it for another year, and then...
What did he say to you?
He said, I don't really understand what happened.
That was his answer?
Yeah. So I had a choice, and I remember the conversation. My parents are massive influence for me. And I remember my parents were saying, you have a choice, you either give up, and if you really want to do it, then you do it and you apply. So I applied the following year.
Was it a woman thing, do you because around that time there was Baroness Cumberledge's glass ceiling committee, wasn't there? And there was a whole debate about encouraging women in management, and should we have a percentage of boards women, and there was a whole debate going on. I remember, and I ended up on Cumberledge's committee to encourage more women into management roles. Did you come across that? Was it a glass ceiling thing?
I can honestly say I have never experienced overt approaches like that at all. It's never. I genuinely don't think it is. I think it's an interesting environment to be, and I think I have a responsibility. I'm a working mum. I am a total muppet when it comes to it. So of trying to balance like everybody else, but I've never. And I think I have a responsibility to support people, but it's on ability. So I've never experienced it. I think I've never experienced it overtly.
Yeah, that's good, isn't it? And how do you juggle? Because your old man is a chief executive at Milton Keynes, and a jolly fine hospital it is too, and he's just become a professor. Is that one with one F and two S's, or two F's and one S? I'm never sure.
I will never be allowed home.
And I'm going to Milton Keynes to see him tomorrow, so that's
purely coincidental.
It is coincidental. Yeah, they did some fabulous stuff. They're doing some great stuff on nurse training. So I'm going up to have a look, and it's quite by chance that we're doing this tonight. So but I'll be seeing him tomorrow.
So what was the question?
I think it's about being. I mean, a lot of people, in the audience will think, God, because you've got twins. It's not just like having a couple of kids. You've got twins, and your husband's got a big job in the NHS as well. And we all know that, these top jobs are not just about 9 to 5. You've got evening meetings. You've got public meetings. You've got all the stuff that goes with it. Do you have a nanny?
We have a nanny. We definitely have a nanny. We just changed. Our nanny's just changed, and it's one of the most traumatic times because the whole kind of stability goes. It's okay. I don't think you can have it all. It's my personal view. You can have bits of it at various times, and balance shifts. And this is part of a raging debate with other people that have kids or don't have kids. So it's okay when home's okay, but if it goes out of kilter. So I think we made a choice that I was late having children. Apparently I was an elderly mother at 38, and that doesn't sound very good, by the way. And we are very, very, very lucky to have them, and what will define me is not my job. My children are the most important things to me. So I spend a lot of time trying not to apologise for not being in places that I possibly should be politically, but actually, and my mum died when she was 48, and that's, for me, they are the most important things. So I have a totally unbalanced. My team will tell you I'm totally unbalanced. Full stop. But I will go home. I leave. I try and get home to put them to bed at least 3 nights a week, and I won't compromise. I need people around me to stop me. Make sure I do that, but I won't compromise. Yes, I'll then work in the evenings. I do work and stuff, and some very late night conversations with people that really shouldn't be working at that time. But you know what? At the end of the day, they're the most important thing to both me and Jay.
Well, you've got to have a fulfilling life yourself, haven't you? And do things that interest you and you want to do it. Okay, so you did the outpost thing. What happened then?
I applied for the training scheme.
Well, we've done that.
I got on.
Oh, you eventually got on?
Oh, yeah.
Okay, so you managed to sneak onto the training scheme.
Yeah, I snuck under the radar.
Yeah. And?
Best and worst 2 years of my life. People try to break in. Professionally...
Can't hear at the back.
You can't hear?
Could you just try to speak up a little if possible?
Yeah, can you not hear both of us?
Not very well.
Oh, I'm sorry, we should have said earlier. Okay, well,
Please don't make me do the whole thing again.
Okay. Right, can you just slide that up a bit? Oh, it's at the top anyway. No, that's okay. It should be all right. Yeah. Okay, now we'll just speak up a bit. Okay, well, let's start again. Thank you very much for coming. It's very nice to see you, Phil. It's your cookbook and, blah, blah. Okay. Weird. Okay, so you managed to bamboozle your way onto the training scheme.
Yes.
And it was the best and worst 2 years of your life. Has anybody else been on the training scheme? Anybody put your hand up? 1 or 2? survivors of the training scheme? Good, yeah.
It's an amazing scheme, and we should be extraordinarily proud of it. And the reason I say it's the best and worst is because it is what you make of it. Professionally, you're given exposure to absolutely everything, and you choose how you are. And I'd come from being in the NHS to do the training scheme, and I would fully support and it's not the only way of doing whatever you want to do in the NHS, but it is fantastic.
Yeah, I was surprised in Simon's office. He's got 2 management trainees working in his office.
Yeah, we have management trainees. Our responsibility is to support people coming through.
Yeah,
absolutely. And we have management trainees, we have clinical fellows, we have fast track, and we have others. I'm just trying to remember. So our job is to make sure we support people coming through. So professionally, fantastic. I went to Central Middlesex Hospital, which has shaped me as a leader, or whatever I am, in every single which way.
That was a big old challenge, really, that hospital, because it was a prisoner of its geography, its past, its overheating health economy. I mean, just about everything was wrong with that place.
And it delivered.
And everything was right with it as well.
So the leadership under John Pope, the executive team have been together, I think, about 10 or 11 years.
That makes a difference.
Phenomenal. There were 2 rules with John, is it safe, is it legal, do the right thing. And it developed the first ambulatory care and diagnostic centre in the country. Phenomenal. And it was a group of people that probably from a governance perspective weren't necessarily as it should be, and there's a massive amount to learn from things it didn't do well, massively. But I remember, it was a team all the way through. So if you wanted to know where John was as the chief executive, he was in the Porter's Lodge talking to Stan, and that's how we learned. That's what we learned. And but worst because my mum died 6 weeks into the training scheme, and spontaneously. And I remember Mark Britnell was my mentor on the training scheme. I remember phoning Mark and saying, I won't be in tomorrow. My mum's died, and my father's having an acute psychotic reaction. I'm standing in the garden, and he's barricaded the door, and I won't be in. And Mark saying, "Okay, just let me know when you're coming back." And so the point being, I learned about the most amazing care. Unfortunately, my mum died, but from the John Radcliffe, and I also learned about not so good, fractured mental health care. From no mental health history whatsoever, with a grieving family. My brother is 8 years younger than me. He was 17. My mum died. My father had just been sectioned, and we were just left. We were just left by the system. And okay, we were 24 and 25, but that turns your world upside down. And then the care that was provided wasn't as it should have been. I remember. And my brother's a criminal barrister, and I remember phoning the hospital, and he'd been sectioned. My father had been sectioned, and they said he was on 15-minute obs because he was a very clear suicide risk, as they called it at the time. And I remember phoning and them saying, "Yeah, he's absolutely fine." As he ran in back, he'd escaped from the hospital, and he'd run 10 miles back from the hospital. So they hadn't been doing the checks.
10 miles in 15 minutes.
I mean, my father is amazing, but
No.
not that amazing. And the reason I make the points are because that's what drives me, is to learn from
It's
that.
a powerful story. And I mean, I, as you know, used to run mental health services, and they're still not really, I mean, with every respect to anybody that's involved in the services, they are still the Cinderella service of the health service.
I think that there is some phenomenal work going on around the leadership and the delivery of mental health services.
Claire Murdoch, for example.
Yeah, and many others. I think that I'm an acute. I feel like this is a confession. Hello, my name's Sam. I'm an acute trust chief executive, and apparently there's quite a lot of stuff going on outside of acute hospitals. Who knew? and including within mental health, and I have learned so much. So I'm not sure I actually do agree with you. I think there is some phenomenal work going on.
No, I'm not saying there isn't. I'm saying it's still the Cinderella of the service, and I still don't think we're anywhere near the parity in what's described in the Constitution. I'm not saying people aren't trying. I know they are, but I'm still saying, I stand by it, saying I still think it's the Cinderella service.
There is work to do to make sure it's equal. I do agree.
Yeah. Well, now you're starting to sound all political.
No,
on me, but
no, I'm agreeing with you.
yeah.
Yeah,
It's the end of your career. Right. Okay. So you were doing all that, and then you left Middlesex. What happened then?
I stayed. I wrote on the Cook's tour, which I cannot recommend the training scheme highly enough.
Yes. What did you know was going to happen to that? Because there's the Leadership Academy, isn't there now?
Yeah.
And I'm not sure. I don't have any inside knowledge, but the way the Treasury is cutting non-patient facing services, if they can cut the CQC's budget by 30%, yes. Then I think other organisations are probably equally more deserving but more vulnerable. So I hope we're not going to see the end of all this.
There will always be need for leadership development.
Yeah.
Full stop, and I don't think there's any question.
Do you think? It is interesting. Do you think the leadership development should be within the NHS, or should we say, look, there's a bursary, go to Harvard?
So we're not running bran flakes. We're providing patient care, and therefore we should be supporting people who understand what it is that we're delivering.
Okay, then go to Mount Vernon. Not Mount Vernon, a place in America.
I went to Hillingdon.
Yeah. No, you don't want to go to Hillingdon. But we could. There's plenty of hospitals overseas that have got a good reputation. What I think that we are somewhat introspective in how we train the leaders. We look inwards too much.
I don't think I agree with that, actually.
Really? You look at Mark Bricknell, for example.
Yeah.
What I mean, I don't know if any of you came to the Mark Bricknell evening, but he was stunning.
Yes.
And he was stunning because he travelled and he'd seen other things and he'd had other experiences. He wasn't just inward facing, and I think that makes a big difference.
But the training you get, whether it's on the management training scheme or in other leadership training, it does give you the exposure to the international. Now, I do agree that we've got to learn from other places, but the reason I'm slightly hesitant about agreeing with you full stop is that we've got so much to be proud of within the NHS and share that it's too easy to go, it's just not good enough, and we need to look over there, wherever over there is, because my geography is horrendous. Says my PA, who gets me from A to B usually. So I think actually we need to do more of celebrating and also learning. I do think if I knew as a chief executive what I now know a few months into doing this job, I think I would have done my job very differently. So I think there's a balance that we need to strike. More importantly, the best bit of learning that we ever had was the paired learning with the clinicians and the registrars and the work that Bob Claber and others are doing. We did a version of it a few years ago as a trainee. That's where the biggest learning is, because that's how we break down the unnecessary silos. So after that, on the training scheme, I wrote to Alan Langland, the then Chief Executive of the NHS.
I love the way you just got to batter the doors down. So, well, I didn't get on the management training scheme, so I went and saw the bloke that ran it and said why. One of the jobs I wrote for Chief Executive. This is good, I like this.
So I kind of think you make your own.
So what did Alan have to say to you?
So
he was a kindly man, wasn't he?
He was fantastic.
He's the dean of something or other in Glasgow. Is he Edinburgh University?
Yeah, so yeah. I wrote to him and said, can I come and shadow you for a week? I was a management trainee. Nobody told me I could, nobody told me I couldn't. And he said, well, actually, can I come and shadow you? And he said, I just thought I'd have a go. And he said, yeah, come and shadow me for a week. And after every meeting with him that week, he took me into what I now realise what it was, but I was like quaking in my boots. The meeting with Stephen Dorrell and the executive team meeting, the equivalent of whatever it was then. And after every meeting, he asked me what my reflections were and what would I have done. I was a management trainee. I kind of just left nursing, still thinking about it, and I had the chief executive of the NHS asking me my view. which really, really informs me. So all the way through, people have given me space and time, and even if they haven't wanted to listen, I've given them my time anyway.
But it shapes you as a leader, doesn't it? Because you remember that, and you think, well, how can I help? You know how much they help you, and then you say, well, how can I help someone else by doing that?
Yeah, we have a responsibility, full stop. And if nothing else, my job is about supporting people coming through.
Yeah, I think that's very important. Okay, so so you destroyed Alan Langland's career.
Yeah, it was all. So I did the training scheme, and then I made a decision to stay at Central Middlesex, which was fantastic. I was the assistant general manager for surgery.
Assistant general manager.
I was very proud
I love
of
it.
that.
Yeah.
I have to tell.
Assistant general manager.
I remember being shouted at from before one end of the Central Middlesex corridor. It was a very long corridor which they rebuilt, which was fantastic because John Reardon, the inspirational medical director, wanted. He knew that all the business was done on the corridor. So when they built ACAD, it was all about the informal interactions, and that kind of stuff really sticks in your mind. So I remember standing at one end of the corridor, and a very, I think he's still practicing, so I won't make his name, standing, an orthopaedic consultant, standing on the other end of the corridor and shouting, "Oi, Jones, what the F have you done with my clinic?" I mean, actually thinking I'm going to be sick on the spot because there was this consultant. But the point being, the operational management jobs, I absolutely loved them. They are the hardest jobs in the entire world. I don't care what anybody says. I learned how to manage medical secretaries. I learned all of that stuff. So
Box of chocolates as a medical secretary.
Just doing what they say.
Yeah.
Really.
Yeah, they run the hospital, don't they?
Oh no, actually they do.
Run the appointments.
They truly run the consultants,
yeah.
and that's okay. So one has to understand the relationship. So I did that, and then I was.
Then we wonder why choosing book doesn't work.
It's about the relationships and the behaviours between people. So then I was asked to go on secondment to the clinical governance support team with Aidan Halligan when Aidan Halligan was setting it up.
Yeah, now Aidan sadly passed away as a young man, really. He was if you haven't, you may not have met Aidan, but he was an Irishman. He had a wonderful way of speaking, a charismatic speaker, and charming, an absolutely charming man. And we would have interviewed him. Certainly, he was on our list. And I couldn't believe the news when it happened and he passed away. But he was a thoughtful, interesting, articulate man. Always thoughtful about other people. Must have been a great guy to work with.
You have one life.
Yeah.
So we were setting up the clinical governance support team, which was around supporting the implementation of clinical governance across the
Which
NHS.
nobody wanted.
Well, I actually didn't know what it was.
Yeah.
But if it's about supporting people to deliver care as safely as can possibly be done. So I worked out, and I'm so going to regret, I know I'm going to regret saying, I worked out that working at a regional level didn't really suit me because I wanted to sleep in my own bed. These are quite informative career decisions that I make. So I did that for a year. It was a year's secondment, and I went to Barnet and Chase Farm. My master's, which I did through distance learning, because why would you do it in an easy way, is in organisational change and leadership, and I'm really attracted to challenging situations. So I went to Barnet and Chase Farm, something to do with surgery and anaesthetics, and I remember crying my eyes out when we didn't deliver 18 months. I won't tell you the name of the patients because that would be inappropriate, but I can remember the name of the patients, and we didn't deliver 18 months by about 3 patients, and that was devastating. I also remember some very challenging consultants who swore at some of my team, and I wasn't having it. So I went down to challenge. It wasn't quite what they said. It was actually what they said. It was how they did it, and I had a vote of no confidence in me.
Oh, that's good. That's a real career-shaping thing. I've had several of those. It was really good. Yes. I'm really sorry, John. Can you have a look in the cupboard to see if you can crank up the?
I'll get in the cupboard.
The volume.
Angus is on the case.
Angus is on the case. I'm really sorry. We are somewhat in the hands of the King's Fund, who set all the volumes up for us and then go home. And I don't know what's happened. Sam, speak up.
I'll go and have a word.
Hold on a minute. Let me.
You might get hot if you turn the aircon on.
Does that help? It's a microphone. Who knew?
It's slightly awkward though, isn't it? Can you manage that?
I can hold it. Can somebody hold it for me? I'm
Where's your
kidding.
PA? I'm the microphone holder to the Vanguard Easter. Come on, get on with it.
Where were we?
I don't know. Somebody swore at your staff, and so you went down and kicked the shit out of them.
No, I didn't go and kick the shit out of them. I challenged that it wasn't an appropriate thing to be doing.
Yeah.
So I had a vote of no confidence in me. But what was equally as informative was another set of consultants standing behind me and going, she's doing the right thing. For me, it's about how the people who are doing their best are treated. And so anyway, I did that, and then I did a variety of operational management jobs.
Take off the muffler.
I'm so glad the comms team aren't here.
No.
Can you hear me?
We've got the AV people are coming.
Okay. Shall I walk?
Far away. Go on, keep going.
Anyway, I did a variety of operational jobs, and then I went to I was appointed to my first executive director's post, and the person who appointed me promptly left, and that was my lesson about working for people who.
That's going to pop. Sorry, I'm really sorry. We've got a really clunky evening here, haven't we? Apologise.
Why don't you swap over mics?
I don't think it makes any difference.
Because
we can try, but I think it's just the strength of Sam's voice, but we can try.
is that okay?
Yes.
I'm just going to sit.
I think mine's much better. Really. I think you just hear my voice.
It's
Yeah.
not. It's not about me. It's about Roy. So I did.
We've still got 20 minutes left.
I know. So I did anyway. So I did a variety of directors, but I learned about working with people who enable me to fly.
Yeah.
If that's the right expression. And then I went to work for Claire Paniker at North Middlesex and. Name check, Mrs. Paniker.
Well, in her day, again, she was another big icon of the health service, wasn't she?
In her day, she's still at Basildon.
Yeah,
She'll kill. She's
but I mean, at that
fantastic.
time, she was
Yeah.
at sort of preeminence.
So she, so Claire knows the name of every single person in her organisation and manages to combine strength and steel and focus on delivery in the same way, being a decent human being. And fantastic person to work with, and I covered her maternity leave when she went as chief executive on maternity leave, and then I was appointed to Excellence in Helier. Yeah,
that was your big break, wasn't it? Where you really you ran like a proper hospital, and it was a dump.
I'm extraordinarily proud of what the people did at Excellence in Helier hospitals, and we have to stop.
It had all that awful cladding on the outside.
It had an interesting architectural style. It still does. It's actually a listed building.
Yeah,
it is a listed building.
I don't know if you've ever seen it, but it's got
modern art, 1930s.
It's got white panels on the outside, and they're all stained with rain and verdigris, and some of them are falling off. It looks horrible.
But you know what? The care is fantastic.
And down the road, you had Swalloyock, didn't you?
I had Epsom, and we had
which was built by Adrian White.
The South West London Electric Orthopaedic Centre.
Yes, Adrian White owns Bywater,
Denby's
and Denby Vineyards, and he actually endowed these buildings, didn't he? Paid for them.
He did. And I learned about the strength of the local population and doing things properly.
Yeah, they're very proud of that hospital, but I mean, it really is a terrible place. Not the people or the work. I mean, disassociate yourself from that. But I mean, in terms of an architectural monstrosity and a difficult building. I mean, I don't know who the estates director is there, but whatever he did in a previous life to deserve that job, I don't know.
I think it's about recognising the challenges that our staff have to deliver care in the most amazing way. And my children are treated at St Helier, so yes, of course, it would be amazing if every single building was beautiful, but it's not.
But it just is. It's got those. Oh, it's just.
I know. So then I spent some time in the independent sector.
Well, I want to talk to you about that. Just don't gloss over that. So, what what happened? Were you headhunted for that job, or did you just decide? Because you went to work for Care UK.
I did, yeah.
Which I thought was a good move. A lot of people thought you'd given up the NHS and you had gone and sold your soul to the devil.
Were the exact words I think that somebody said to me, yes.
Yeah. So how did that happen?
So I was travelling 2.5 hours each way to Epsom because we'd moved and the children were a year old and it's not conducive for a family life. And it was one of those moments of thinking something has to give and this is going to give. At the same time that I was asked if I'd be interested in having a role with them. I learned a massive amount at KUK.
So they headhunted you?
Yeah.
Yeah, because they made a big thing of it on the website, didn't they? Because there is this slightly schizophrenic relationship that the NHS has with the private sector. They really bigged up your appointment, saying, you know, because of Sam's commitment to the NHS, her commitment is our commitment. And I remember reading it on the website at the time, feeling slightly sick. They really did big that up.
So I learned how.
Are we sorted this microphone out or not?
Can you hear me?
It's as high as we can get it.
Is it?
We have cranked it up a little.
Okay.
It should be better.
So I remember being challenged by Mike Parrish, the chief executive, about why would I settle for mediocrity? I remember the conversation. We were talking about statutory mandatory training. There's a massive learning in this. So the work that the independent sector did was at the same standard, if not higher, than a lot of the stuff that we were doing. It's outcome based, and this is not exclusively, of course, it's not. But about statutory mandatory training, why did I think that 85% was acceptable? Because this was about making sure our staff were supported in the right way to a high level. And I really learned that don't settle for mediocrity because you can do it collectively. And I also learned, which my team will laugh now about, which is you win a contract, you mobilise within 6 weeks, and how do you do that? Nothing is impossible. Everything is possible because it has to work, and it can only work with the clinicians doing it, and that's what I learned, massively learned.
At KUK.
Yeah.
And then, of course, you went to Watford. You seem to specialise in working in the middle of rubble and building sites, because Watford is, again, a wonderful hospital. I came up and saw you there, met some fabulous staff, but the place was like a pile of scaffolding. It was dumb.
It has many infrastructure challenges.
And I met, do you remember when we sat in the canteen, I met some of your maintenance guys, and they were terrific guys. They said, what the bloody hell are we going to do about this then? But I said, we're going to paint it. He said, can't paint it, put a brush in it, it'll fall over. It was great guys, weren't they?
They were fantastic, and the staff at West Hearts, Watford's and Albans and Hemel were absolutely phenomenal.
Yeah.
And not a beautiful environment, it's fair to say.
Yeah, it was. You did get some money to do something about it, but you weren't there long enough to get it done. Right? You did get capital, didn't you? Too?
Still work in progress.
Yeah, I know you put in a bit in. And of course, what really brought you to preeminence then for Twitter followers of Sam was when you did Operation Onion.
Yeah.
That was that, and everybody stopped and said, "Wow, hang on a minute, this woman's doing something really different here." Tell us about Onion, because I don't know what's happened to it, but it was at the time we all thought, wow. We all went to see it.
So James is here, so he'll tell you the truth. James is here from West Hearts. So forget anything else that you have heard or not heard about Onion. I had been appointed. I was 6 weeks into being the chief executive. I went away for a weekend, which is allowed. I came back and we'd had 7 ambulances queuing on the Watford site and another 6 on the way, I think it was, and we couldn't offload a 16-year-old who self-harmed. And I remember talking to the staff and think that was horrific enough. What was even more horrific was that they'd given up. They felt that nobody was listening. This is just what happened. So purely instinctively, based on no methodology whatsoever, that was on the Tuesday. I said I'd like a summit. On the Thursday, and I asked one question, which was, what can we do today to improve we have good issues of patient safety, what can we do today? And then we did it. And we cancelled all meetings the following week, and unless it's for patient safety, and we just did it. And some of it we got right, some of it we didn't get right. It was really challenging, and we did it 8:15 every morning in the A&E seminar room. I remember feeling sick about some of the things that we were hearing. Every one of the executive team was there, day in and day out. And the only rule, and it was very sophisticated, we have flip charts and a pen. We didn't have an action plan, we didn't have any minutes, people had to come and say, this is the issue and this is the help they needed to deal with it. And I remember Julie Bailey coming, and the advice was we were saying just be normal, just talk about the issues that we have and what people are doing about it. And then people from Basildon came and they did stepping up, and we're really proud of Onion because actually it was about peeling back the layers to get to the root of the problem. And yes, we cried many tears, many tears, and I realise in retrospect what we were doing is giving people a voice and doing something about it.
Yeah, but you had to find a methodology of giving people the confidence, one, to come, two, to excuse me, to say what was wrong, and three, it's no good saying what's wrong and we'll fix it if you don't deliver.
Yeah.
So those three elements really
Yeah.
are the tricky ones, weren't they?
Yeah.
And I think once people saw that you were delivering,
We weren't delivering. We weren't doing, and it was really hard for the executive team not to say anything. We spent a lot of time stopping people saying things because our jobs are to make it okay. Yes, that's what we did, and the chairman was there. The non-execs came. It was very, very challenging for people because it turned upside down all the governance structures. People came. We had a porter that came who talked about the lack of dignity and respect that we were giving to people that had died because the transportation for the body just didn't look right, it wasn't big enough, and we changed it. And he came, and I remember him standing with his leg quivering because who was he? And I remember holding his arm going, it's all right, just say it, and we did it, and he designed it. And it wasn't done in any service improvement methodology or any of that stuff. We just did it because for me, the fish does rot from the head, and if I wasn't going to be brave enough to say the line had been crossed, and I remember so very clearly thinking, I have a responsibility here. I don't know what it is, I don't know what I need to do, but I need to be able to give the staff belief. And for many challenges, and the medical director at West Herts, Mike Vanguard, and the chief nurse stood there day in and day out. We had a 21% reduction in mortality. It wasn't just as a result of Onion, there are loads of other things that are happening. The fracture neck and femur team are now from a mortality rate of 12.2%, I think it was, they're now up for a patient safety award because they've got one of the lowest mortality rates for the service in the country. So did it deliver outcomes? It was really challenging, but there was some science and stuff.
I think from what I saw there, you gave the organisation its confidence back. People felt they could do stuff rather than just come to work. I thought it was a great atmosphere.
They were a great team.
Yeah.
They were a great team.
But you have to make a great team.
They were a great team.
Yeah. And then, of course, your career went really downhill when you went to work for Simon Stevens. Sorry, Simon, if you're listening. Yeah.
I'm not agreeing or disagreeing.
So, and I think what most people have paid their money for tonight is to find out what the
Listen about
bloody
me.
hell is a Vanguard. I have no idea what it is. I think it's a great idea. I've written enthusiastically about it. I've said we should do more of it. I've put my whole writing thing on the line and said it's fabulous. The truth is I've no idea what they are, but I just think it's a way of breaking the mould, and it all looks very different, and people that are doing it are very enthusiastic. I went down and sat in the back of I just turned up at you had a gig going on down at Surrey Cricket Ground, and I thought if anyone's going to come to my cricket club, I should be there. So I decided to invite myself and stood at the back whilst you were doing was it the second cohort?
It was the acute care collaboration.
And I thought the way that people, I don't know if you know how it works, but people come and make a pitch in front of everybody else. Have we got any Vanguards here? Any Vanguardistas? No? Well, the way that you get what you'll tell us.
They've told me what I have to say then.
Yeah, right. the way you get Vanguard status is you stand up in front of other people who want Vanguard status and you do a pitch, and at the end of the day they take a vote, and, you know, subject to not very much. That's how it works. And I thought, wow, you know, that I like that. It's disruptive and unpredictable, and I think we need a bit of that.
And actually patients and clinicians made the decision.
Yes,
So
yes, in the audience we had patients, which I thought was the death knell. I mean, for God's sake, I mean, fancy involving patients in their care. Whatever next?
So a Vanguardista, the Vanguard, the definition.
I think I called you the Vanguardista.
Yes, you did, thank you for that.
Yes, she's the Vanguardista.
The fashionista from Vanguardista. So we, Vanguards are a group of people doing interesting things. That's a really great definition of it. And for those of you that are perhaps more military minded, it's the front of the army. I'm sure there's another bit to it as well. And basically the care models, as articulated in the 5-year forward view, are around designing the future NHS today in a way that we would want to if we were using.
Well, hang on, a 5-year forward view is, you know, it's an interesting document, but I mean, there's not much in it in terms of what the next 5 years is actually going to look like. I mean, somebody's saying it's going to look different. It gives us a few clues and said it's not about 1,000 flowers. But when I look at the Vanguards, there's a great disparity in them. I mean, you've got some that are really quite small and local and very worthy, and I'm not, you know, saying they aren't, but you've got others that are vertically integrated care, and a whole system changes, aren't they?
So the Vanguards, there are 50 Vanguards now, covering, we were trying to work it out the other day, some made up stat, I think it was about 12 million, 13 million, I don't know, the population probably slightly more than that. The Vanguards are actually health and social care systems working together. They're not small. So mythbuster number one to blow is that there are about 14 or 15 different kind of health and social care systems working together. So we've got the voluntary sector, we've got primary care, we've got acute care, we've got community care, all working together. So if you take any one of the Vanguards and actually peel it back or look at actually what's happening, they're not small. What they are though is a population-based approach of systems working together, institutions working together to redesign and do it, and that's why I think it's really interesting. So I would challenge that it's small, because it's not, but yes, they are different.
Yes.
There are some core components, so I don't know about you, but a multi-specialty community provider doesn't really kind of rah-rah, sorry, so we get into trouble for that. But what it is about a network of care being provided for Norman, my father-in-law, who is 89, who has 27 health and social care professionals going to see him every day because he's in his house. And over his dead body will he leave, and they're not able to communicate with each other, and the systems don't work, and we don't have data that crosses the population, and the funding streams don't work, and the national policy way doesn't incentivise care around patients and a network, and that's what the Vanguards are doing.
When I look at the Vanguards, I mean, and it's the kind of elephant in the room with the Vanguards is, first of all, there've been wholesale changes, and none of it's gone out to tender. You can argue that because of the way they're structured, they will narrow choice. They may well give better services, but they will narrow choice. Where does that all fit in with the regulators now? How does Monitor sit with that?
I'm not sure you're entirely correct.
Well, then explain. I don't have to be, but you do.
Douche. So the care model programme, and this is actually really important, is sponsored by all 7 of the arm's length bodies. And
is there a sort of realisation that the reforms just don't work, and we're going to get on and do things anyway?
There's a realisation that we have to work together to make things happen for the patients that we serve. And our job through the care model programme is to support the local systems to deliver the changes that are needed, and that's what the 7 bodies are doing. So if you take what's going on in Birmingham through modality, formerly known as Vitality, if you take what's happening in Cheshire, it's systems working together, and we're asking people to work together to provide care for a population. That's what this is about, and the least we can do is enable the changes from a national policy perspective to make it happen, and that's including Monitor, TDA, NHS Improvement, NHS England, CQC, Public Health England, NICE, every one of those 7 arms length bodies. The new care model programme reports to the 7 chief executives, they are putting their money where their mouth is. It's not easy because it's fundamentally turning upside down all the things that we say shouldn't happen, and it's also incredibly difficult to be a Vanguard, not expecting any sympathy for them, but actually they are challenging the pricing structure, the tariff structure, so that and our job, and if you haven't read the support package document that was published on the 29th of July, please
we all
have a
have.
look at it.
Haven't we,
Well,
Phil?
the reason, because if you don't know what the Vanguards are actually doing, the Vanguards are actually designing the future NHS, and our job is to enable that to happen from a policy perspective, and really importantly, from a patient's perspective, from a choice perspective. It's having a different conversation. So whether it's a new enabler number 3 is the integrated commissioning and provision work stream, and that's
We're just losing viewers by the score.
Well, strangely, I'm quite now interested in it. The words I never thought I'd say. But it's around a funding formula to support a network of care to be provided around the population that we serve. To actually, and the best thing I've ever heard over the last 6 months is a GP in Hampshire, I think it was, saying, being a Vanguard it has reinvigorated my faith in why I came into medicine, because we're doing it around the patient, and actually what we're doing is redesigning the NHS as it should be, and that's what the Vanguards are doing.
So, okay, by the end of this Parliament, we know when that is, what does good look like? What have we achieved? What will you say? Yeah, we did a good job with them Vanguards.
We're not doing it. The Vanguards are doing
you
it.
know.
Yeah, but it's quite an important
All
point.
right, okay. Well, you can wriggle off the question.
No,
You still got to tell me what good looks like.
I haven't finished.
What does good look like?
I haven't finished yet.
Well, tell me.
The point being, for the first time, actually the local systems are doing it and holding the national to account, and that is really hard.
What does good look like?
Good is having a redesigned NHS where the majority of the NHS is covered by the care models.
I don't know. What does that mean?
It means all the things that we moan about now and all the reasons why things don't happen, whether it's institution focused, is now actually totally being put aside.
So you'll get social services and healthcare sharing budgets and doing good
It's
stuff.
already happening.
Yeah.
Up and down the country, social care is involved in every single
They got no
Vanguard.
money, have they?
The Vanguard and the voluntary sector are involved in the Vanguard. The two bits are being involved in this programme. The first one is believing the impossible, that you've never thought you'd be allowed to do. All the reasons why we can't do and deliver care that needs to be delivered in the way that we want to do it. The Vanguards are pushing and changing. And the second is that it's being designed around the individual patients and the population that we serve. So we've got the fire brigade. We haven't. The Vanguards fire brigade are involved, the voluntary sector. And it's not about shifting money, because I think it's, if you have £2 £10, it doesn't make it any more, or whatever it is that Simon says far more eloquently than I could ever hope to. It is about saying, actually, when my son had meningitis, he didn't get sick in isolation from an acute perspective. He got sick when he needed care from a community service. He got sick when he needed care from primary care. The point being, we all know what I'm trying to say, which is that the Vanguards and the care models themselves are designing real time and doing the stuff that we know needs to happen to make a future NHS as it is now, including the funding mechanisms, including the leadership, including a different type of workforce. The way I was trained, albeit fantastic, isn't right for now, nor will it be right for the future. That's what we are supporting the Vanguards.
I just saw Health Education England is doing a new curriculum for community nurses. Do you know anything about that?
So within the care model team, we have Health Education England, we have Monitor, we have the TDA, we have NHS England, and we are collectively supporting the Vanguards.
The Health Education England new curriculum on community nursing, is that going to be sort of more Bertsov model than we have now? I mean, we don't want to train more community staff in the way that we're doing it, do we?
There will always be a need for specialist staff. There's no question about it. But I would challenge that we have to start with what the patient needs, and then we work back. And it's quite challenging from a professional perspective. That doesn't mean to say that we don't need GPs. It doesn't mean to say we don't need specialists. But it does mean actually maybe we need to be something different.
Oh, all of it needs to be different. You start with the patient and work backwards. That's a great phrase. I wonder where that came from. I like that. Yeah. Okay, so you don't know what good looks like now.
I do know what good looks like, and if you want to see what good looks like, go and see what's actually happening both
Well,
in the Vanguards
actually, you
and
can-
outside of the Vanguards.
You can have a look at our website because
Oh, sorry.
we are hosting, God knows why, and John, my business partner, isn't listening because we've had to expand the server, and we just love doing things that don't make us any money. That's that's our job in life. But we got somewhere or other we got persuaded to host the Vanguards on the Academy of Fabulous Staff. And to tell you, the interest is colossal. We had about, was it Terry, 9,000 hits or something?
First month.
On the first month, 9,000 people had a look at what it is. So it has created an excitement. But I do think there is a lack of. It lacks the kind of the elevator pitch. In a sentence. What is a Vanguard? That's really what we're missing here. Is the elevator pitch is look. Have a look at your services and fix them. Do what needs to be done, and we'll sort it out later. It's a bit of that, isn't it?
So I take your point about elevator pitch. I think actually being a Vanguard is designing the future NHS and making it happen today, and that's what they're doing. And it's not just the Vanguards that are doing it. So this is about making sure that we have a primary care service that is linked in and working with, and is already happening. Whether you go to Birmingham or whether you go to Yeovil, you actually have all of those institutional boundaries that get in the way of decent, consistent, sustainable patient care, which, by the way, who knew is cheaper, which will deliver the efficiencies that are required. That's what the Vanguards are doing. But not just the Vanguards. And part of our responsibility and part of being a Vanguard is supporting others to do it.
Yeah, do you think you've introduced a sort of another sense of elitism, like we're a Vanguard?
Yeah, it's interesting, isn't it? Because do you know what? Let's just give them a break and let them deliver. Everybody was given an opportunity. It went out to the whole of the NHS. We had 269 applications for the first round. We've had nearly 400 in total. Do you know what? Let's not dumb them down. Let's give them a fighting chance, because we are very proud of the service that we have. Do you know what? It might be elitism, but it's okay for people to go first. Somebody has to go first, and actually that's what they're doing. I think we have a responsibility to rah-rah them on our behalf, and do everything we possibly can to get behind them. Not because they're Vanguards and I'm on a mission and you can tell I'm on a mission, but because they are treating patients, and that's what we're all here for.
Okay, we've got a few minutes left. Anybody like to, after that, I just one of my tablets. Who wants to ask a question? Yes, sir. Gentleman with the spectacles. We should have gone to Specsavers. Yeah. Just tell us who you are, because we might want to issue
from an agency called MHP, Health Policy and Communication.
Oh my God, what do you do then?
Well, we support people to put on meetings which bring interesting people together
Really?
to talk about that. Anyway.
So you've come to learn.
Boy, it's lovely listening to you. We've listened to a lot tonight.
That's okay. You can be as rude as you like, because in the end of the day, I got the microphone. Come on.
Anyway, there's a lot of cynicism about the Vanguards, a lot of cynicism about Divo Mank, and lots of people trying to get stuff done. And I think it's really exciting the way you're batting some of that cynicism away and saying, let's just fix some things and sort it out. But potentially one of the harder things to bat away are people saying that there's a lack of transparency, accountability, and people pointing at models saying there isn't enough engagement. People are around the table sometimes, but there isn't enough democratic accountability in the system. What do you think about that? Because you hear third sector organisations say that things are moving at a hell of a pace and they feel they can't keep up.
So I think one of the things I've learned doing a national job for the first time is how everybody has a view without any facts associated with it, and the Vanguards are doing all of that. They're engaging in a totally different way, some better than others. I've really learned that actually, whether you're a Vanguard or not, and there are the voluntary sector people involved, there is more transparency, I would argue, with the programme. Whether it's on Twitter, if you want to see the videos, if you want to see what they're doing, the Academy, they are talking about it, and they're actually talking with their local communities in a different way. So if you go to Dudley, and I won't do the accent, but if you go to Dudley, they've involved the younger people, the teenage changes in the design of their service. In a way, they've got community engagement. Now, these are small bits, and the challenges, and this is why I'm batting back the point about the elevator pitch, is it's the small changes that will make a massive difference, that will ultimately deliver the NHS that we need at a scale. So if Ian Dodge was here, the Director of Commission Strategy for the NHS England, he would say it's about primary care at scale. And yes, it is, because we've got 50,000, 60,000 registered patients involved in things. All of that is very public. Do you know what? Let's get behind them, whether it's DevoMank, whether it's the Vanguards. Do you know what? Because they're doing it for and on behalf of patients and ultimately the taxpayers, and that's what this is about. So I would argue it's not
What do you think is missing then?
I personally would argue that nothing's missing. I think it's fantastic.
Well, no, you asked the question, what is missing?
The interesting thing, when you look at challenges, particularly in Manchester, a lot of people saying that these are...
Some of the Vanguards are in Manchester.
Yeah, but when you look at DevoMank in particular, people saying there aren't enough elected people involved. There aren't enough, essentially, didn't we insert health and wellbeing boards into the reforms to make sure that councillors did all this, and now it's directors and...
It's factually incorrect, because the health and wellbeing boards are all involved, including within Manchester in DevoMank. And that was my point about facts, is that one of the challenges that we have, and it's a challenge that the team, as we try and get to speed very quickly, is we're there to support and enable the Vanguards. Part of our job is to talk about what they're doing and to enable them to, but actually they've got to get on and do stuff. But the NHS and we collectively are pinning a lot of things on the Vanguards. Don't wait for the Vanguards. It's not about the Vanguards. We can all design the future models of care. Just get on and do it.
Yeah, we had something on the Academy the other day. Somebody said, we're not a Vanguard, but we're doing this. I thought, yeah, that's a result.
That's
Terry, have we got something on Twitter?
Just lots of comments, Sam. People are obviously enjoying your talk, and people are saying things like, one better than the Secretary of State at the HSJ lecture. How do you feel about that, Sam?
We're two very different people doing two very different jobs.
Good answer.
Doesn't it make you sick? Right, who's got a question? Yeah, I think we've got some. Yeah, just go first, sir, and then we'll come to you.
I think Vanguard, Sultan Mahmood for Royal Hospitals NHS Trust. I think Vanguard's are fantastic.
Are you a Vanguard?
We're a fast follower.
Fast follower. I know you love it. And then there's going to be not quite as fast followers. Yeah.
But just it's a good idea, but in terms of the knowledge transfer to the rest of the service, what's the plan for that? Because people like us want to pick up the baton and really get on with it. Contracting and other nasty words get in our way. CCG's kind of pounds per head of population get in the way. All these things are kind of limit us. What's your view on kind of moving some of that along?
So the support package document that was published on the 29th of July talks about the 8 enablers. I'm making the point because in that document it says this is what will be delivered by when, so the rest of the NHS can learn and benefit from what the Vanguards are experiencing. So I know on what date, so tomorrow we will be sharing with the Vanguards the first iteration of an amazing piece of work, not anything to do with me, around population health dashboard across the systems, for example. It's phenomenal. And it's been developed with the Vanguards, with patients and with local communities. In that document, you will see the commitments, the public commitments. That's the first thing. We have tried to learn from the cynicism, and we won't get it right, and give us a break, and more importantly, give them a break, which is why it has changed, not being delivered sustainably in the NHS previously. And if you've read Health Foundation Constructive Comfort documentation, it talks about the policy changes. But we all know, with respect to the people I work for, that change doesn't happen because Simon says it needs to happen in Skipton House. It happens because the clinicians want it to happen, and it happens about the relationships and the leadership engagement and the people who knew talking to each other, and that's what you'll see through the document. So be a Vanguard or not, start at the very beginning. Our spread strategy is doing it in action and sharing it as we go. So to be an MCP, these are the core components. You have to have the registered list, and we'll be publishing that, and we've committed to publishing that. The Vanguards need some space to be able to do the things that they're doing, and they are doing it, and our job is to pull out the national replicability as we go, and it's all documented when we'll do individual bits. it's a bit at the moment of a project plan mechanistic, which is why this kind of stuff and go and hear what the Vanguards are doing. Southern Hampshire have published on Twitter, Nigel, their LMC medical director, leading the way with primary care, has published what an MCP means to Southern Hampshire. They're doing it themselves, and that's what happens in action. That's spread, and but from a national perspective, we'll share it as we go.
It's interesting, isn't it? Because most of the change that we've all seen in the NHS, and God knows I've seen loads of it over the years, you are right. I mean, nothing really changes. We call the same organisations different things, but the Vanguards, I suppose, if there's an elevator pitch, if there is a strapline for this, it's letting local people make the changes they know they need to make. I mean, that's what I think we find it so hard to get our heads around it. You know, we ask, questions about the way in which change has been formalised previously, but it's not going to be formalised like that this time round. It's going to be people changing the things they want to change and get together and do it. And I suppose it's like the aggregation of minor gains or something that Dave Brailsford talks about. It's getting it at that ground level. Let's do another question.
But there are national blocks being moved as a result, so it is about the local.
Well, that's why I asked the question, because if you look at the role of Monitor, which is really there, they'll argue this, but I mean, it's really, if you look at their role as purist, it's there to stop things happening. Things will only happen if they allow it to happen. And now, of course, they've had they got new management in and all the rest of it, and they're trying to shift their role. But they're now saying we're not there, we're there to get out of the way rather than to put the roadblocks in the way. We'll see how well they do with that. Right.
Sebastian, you're a paediatrician. One of the things that really helps systems come together is sharing data, and this has been really tricky, even just within the NHS, primary to secondary care, but then bringing social care. And all of these things are possible with platforms now. I mean, how have you sort of tackled that?
So we haven't tackled it, and I'm not making a political word. The Vanguards have tackled it. So I went running out of the rooms there. I've just seen the future. It's amazing. Because I'm a bit sad like that, because I saw a level of data across a system that I've never seen before. And it's all the stuff that's there available, and all it needs is people to sign something to say, and I mean organisations. Actually, what I really want to say is go to Airedale, so I was in Airedale, the care home Vanguard, or not a hair home Vanguard, as I'm prone to say, and I was there with a very, very vulnerable lady in a care home who was being treated by a GP, not on Skype, on a computer, and it was being beamed, I think it's beamed, real time to the A&E, and the point being made, it's happening, and the point I made about if I was a chief executive now, knowing what I know after the time of doing this job, I'd do it so very differently. Look up and look at what's happening across the service, because it is already happening. So what you describe about sharing data is all possible. Our job, and I really believe this, is to show people where and how it's happening. So Airedale are doing it, but Airedale, all the care homes, Vanguards are doing it, because we've learned from the pioneers. The pioneers have gone through a lot of pain. There's lots of legislation.
Isn't there somewhere that's doing outpatient appointments with FaceTime?
Yeah,
I read that somewhere.
So modality, because I've been challenged by one of the Vanguard chief executives to get the word cool in. So if you could get that trending, I'd win my bet.
What was that word again?
Cool.
Cool.
Oh, that's very cool.
In a 1970s kind of way. Modality. 60% of their outpatient appointments I beg your pardon, primary care, are done electronically, so patients don't have to go in. It's done around the patient and the families as opposed to the institutions. It's already happening, and it's our challenge is to try and pull that out, share that, the national replicability.
And that's really what we're about, the Academy. The whole idea is to try and be the focus of best practice and share the best practice. I thought it was interesting today when the Secretary of State is saying he's going to try and stop hospitals palming the reappointments back to GPs. And I mean, if that's all that happens, it would be a really wasted opportunity, because somebody said to me the other day 30% of outpatient appointments could be done on FaceTime. It's just, how are you, how's your operation, you all right, thanks very much, cheerio. It will be a shame if we don't take advantage of those opportunities. Yes, sir.
John Green. I'm a governor on a trust. And
which one?
Southern Hill.
Yeah. You're a Vanguard, aren't you?
There is one Vanguard.
Yeah.
That's right. I mean, I think the whole idea of the Vanguard is to
I can feel a butt coming. What's the butt?
From GP right through. But what concerns me is that it's operating within what I see as quite a vicious dictatorship, almost a totalitarian regime. And in which case, I think that the units will become creative. They'll want to change a lot of things which will conflict against existing regulations in all sorts of ways. How are you going to protect those units? I cannot see the units surviving and flowering unless they are protected.
Who are you saying are the fascists in the regime? Who are they?
The civil service, the whole civil service. From what my observation of the civil service, it operates right down to first.
So are you saying the civil servants are preventing the Vanguard?
Yeah, the whole management process, the whole way that they manage the documentation.
But who is they?
The civil servants and managers.
Which bits?
The very top to the right up from. I see the organisation is still trying to satisfy the minister and not satisfying the customer. I've seen 3 years of that kind of regime operate. And I'd love to see what you're putting in actually happen, because it's exactly what we need. It will provide a different way of working, more integrated services. But I worry that the regime, in the end, will prevent that from happening. And unless you put those in a bubble of security so that they can flower and operate, I cannot see
let me rephrase that slightly. Do you have ministerial support for what you're doing?
We absolutely have full ministerial support for what we're doing. Full ministerial is easy for me to say. Support for the 5-year forward view, in full support, as reiterated and reconfirmed recently. And all of the 7 arm's-length bodies who are responsible for the regulation and the monitoring and the delivery of the NHS in that way. So I understand the point you're making, and I've been a chief executive for 10 years, and I can tell you all the reasons why things don't support the delivery of consistent, safe, patient-focused care. I can absolutely, and I had the scars on my back for that. However, what I would also say is that this is going to get me a point that I'm never going to live down, but hats off to them, because they, whoever they are, have recognised that change doesn't happen from the top of the NHS. Change happens. They need support to be able to do it, and they are putting their money where their mouth is. I think it's going to be a really challenging time for the next few months, but we have a choice to support the Vanguards and others to deliver the new care models, which is what they're doing, or just not even try. And frankly, I think the population, the people that we serve, deserve that. So I'm slightly more optimistic, but then I'm slightly on the optimistic scale. But we have to be able to do that, and they are supporting it. It's not easy, and I think there are some challenges within the middles of the organisation, like any at different bits of the organisation, to make sure everyone's aligning behind what Simon and Jim and Malcolm and Ed, all the others say, which is this is about focusing on the population, it's not about focusing on the institutions. And your Vanguard is doing some amazing stuff around working with GPs, community services, mental health, and individuals in a different way.
Go and ask them, see if they feel suppressed. I'm going to move on if you don't mind. Yes, sir.
Alan Tanger from the Optical Federation. Can I ask you how other primary care practitioners, such as pharmacists, opticians, audiologists, etc., figure in this Vanguard setup?
Yeah. So thank you, because I would have done the pharmacist a disservice if I didn't. This is about designing it right now. It's not about designing it around individual professional groups. So if you look at what the Vanguards are doing, we have every type of professional and non-professional group, I'm sure there's a better way of putting that, involved.
I mean, non's all right, unprofessional wouldn't be right. Non-professional, okay.
So I work on my whole English thing. They are involved. We've had lots of conversations with a variety of Royal Colleges who are fully supportive, but in the individual Vanguards, it's not about professional groups because they have to be in it. It's professional groups because they have a contribution to improve the service that's given. So we have pharmacists, we have audiologists, optometrists. I'm not going to try and list every single optometrist because I will get into trouble, enologists, to miss somebody. The multi-professional, multidisciplinary, the Isle of Wight, if you haven't seen the stuff the Isle of Wight have done, their integrated care hub, which I've completely just done it a disservice, is every single type of multi-professional group working together in a way that I've never seen before with technology, and that's led by paramedics.
I went and saw it, and I said, you've got to go and see it. The Isle of Wight is fantastic. If you get a chance to go and visit, and they're very open to visits, go and have a look. And it seems to me that if you want to do something good, you've got to put water around it. You know, it's a real psychological thing. You know, it's an island, so we've got to do things differently. Actually, you're all an island, really, but they are doing some great stuff, and they've just got a new chairman, Eve Richardson, who's taken on, who was my chief executive when I was chairman of the trust. So there you are. Patrick, you have a.
What financial support or additional financial support are the Vanguard's going to get? Been getting and going to. I'll
big that up for you. Patrick's asking what financial support, if any, are the Vanguards going to get over and above?
So the Vanguards have all had access to the bulk of the 200 million transformation fund.
Is that all gone now?
No, and because we've still got some Vanguards who've just been appointed.
Oh, of course.
So what the Vanguards have had to do is be able to demonstrate through something called a value proposition, which is how they are going to deliver against the triple aims articulated in the 5-year forward review to be a care model, which is about prevention, it's around care and quality, and it's around efficiency. They've had to be able to demonstrate that. It's been really painful, and they would say that, we would say that we've learned, because they have to be able, there's a line here, isn't there, about giving out money to support innovation and having public accounts committee, because this is public money, and that's the balance that we, and the pain that people have gone through, and they have to be able to demonstrate the delivery against those 3 triple aims. The Vanguards have to deliver additional efficiencies by the back end of 17-18. So this isn't about a free good. This is, they have to be able to demonstrate and deliver additional efficiencies.
But you're not looking for the Vanguards to deliver the 22 billion.
The new care models, no. The new care models programme is a contribution, like everything else, to the 22 billion. But they have had access to. It's been an interesting balance, but it's based around demonstrating delivery against the triple aims.
Anybody else? Yes, ma'am. Oh goodness, I think would you mind speaking up for us?
I was just wondering, obviously the ambition is by the end of the Parliament we will have the majority of the country covered in these new models of care. Obviously that's not that far away, and the Vanguards are being supported with the transformation fund. What's the plan in terms of being able to support the wider areas that aren't necessarily the Vanguards?
From a financial perspective.
Did you all get that?
But also the overall plan in terms of how they're going to be supported to get there.
So the spending review is crucial, and we'll know the outcome of that at the end of November from a financial perspective. What's clear, and repeat what I said earlier, is that our responsibility is to support and demonstrate the national replicable aspects of what the Vanguards are doing, and that's how, and we'll be sharing that, whether it's the contract, whether it's the there will be a new national contract as a result of what the Vanguards are doing. There will be a new capitation-based formula as a result of what the Vanguards
That's important.
are doing.
You said again, there'll be a new capitation-based formula.
So based on what the Vanguards are actually doing. So they're not playing in the sandpit. Is how some very nice somebody, Mr. Britnell, said to me. That what they are doing is designing change in action, and they're designing real hard stuff by the doing. And that's all. It's not new. It's all articulated in the document that was published on July 29.
I'm sick of this document. Did I ever link it? I'm sure I did.
You did.
I think. Oh, thank God I did. I must have read it if I linked to it. Look, I mean, I think what we find so hard, really, to get our heads around is that or certainly I do, is that I'm so used to top-down change, and there'll be guidance, and they'll say jump, and we'll say how high. It's not like that anymore. It's about local people doing local stuff better. It's about enabling the change that people know needs to be changed, and it's about breaking down the local boundaries. If you said, you know, health and social care have got to work together, we'd say, oh yeah, but how about the budget, and does it mean it's means testing, and is it blah, 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 yada, 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 and nothing gets done. But if, you know, locally, with care of the elderly, for example, you know, you need to do a domiciliary whatever it is, a domiciliary eye test thing, then, you know, we can do domiciliary eye test things, and and if you change the way in which services are delivered, are we really going to go out to another 3-month consultation and the world and his wife plods around making life difficult? I just don't think we. What I like about this is the slight anarchistic freshness that there is to it. I think I called you a anarcho-syndicalist, didn't I?
I had to go look it up. I still don't know if it's an insult or a compliment. I think that the point is I've spent 23 years in a service that I love to my very core, and I also expect to be told what to do.
Yeah.
And because, sorry, by the way, I meant completely don't like it, because
I think we learned that earlier on.
Reasons why things can't be done. And actually what we're saying, so what has been said through the 5-year full review is this is where we're going, and this is how it will be supported nationally. And you know what? It's actually quite scary, and it's a way of being done, but it has actually learned that change happens from the ground up as opposed to the other way, and it's the clinicians and the people that are doing it as opposed to perhaps probably more of the
It's the
policy
ground
makers.
up change that works because it's got roots. Top down change doesn't have roots, and that's why I think this will work. Well, I think we've had a really interesting evening, haven't we? Yeah, I think that was good.
At least because you couldn't hear
Anybody
me.
want to? I'm really sorry about the microphone and Sam's somewhat sotto voce voice, but I hope that we managed to
My
struggle.
children wouldn't say that.
I hope we managed to struggle through. Yeah. Oi, Jones, what have you done at my clinic? Yeah. We got a little gift for you. We give all our guests a gift, as our regulars will know. This is a bottle of the world's finest whiskey. It's called Penderyn, and it's made in Wales, and it's the source of all wisdom as it sits on the edge of my computer. And so there we'll have that with our love. It's an extreme. The reason we've chosen Penderyn is, first of all, it's the world's best whiskey. It certainly is. And secondly, in terms of cost, it's just above the limit where you have to declare it as a gift. And so it means that some of the most amazing people in the NHS have actually got me on their conflict of interest list, which I love the idea of that. Ladies and gentlemen, we might just have spent an evening in the company of a future Chief Executive of the NHS. Thank you very much. It's the cocktail hour. Let's go and have a drink. And if you're on Periscope, we finished on Periscope? Yeah, okay. We can just say goodbye to Periscope. Thanks for watching. And if you were watching Dad in South Africa, you should be proud of your daughter.